everybody. Good morning, good day. For this, we're going to start a pilot episode of our YouTube channel, no? And one of the topics is entitled "How to Be Yopo: Meeting Our Mentors." So we have here this morning a very special. I'm sure everybody knows him, no? And he's very active in both in the academe and in his practice. And I'm sure a lot of you would like to know and get to know him better. So for this morning, we have Dr. Ruben LBS joining us in our very first pilot episode of How to Be Yopo. Hi, sir. Good morning.
Good morning.
Hello.
Hi.
Good morning, sir. Sir,
I'm
so
so honored here to be the first one.
of course, always, diba?
Dapat lang.
So, sir, ganito. I'm going to ask you a few questions. So, we want to know more about you, how you got to where you are now, so that we have an idea, no, of uh, ano, kung paano kami maging katulad mo. So, parang ganun siya, how to be Yopo. Okay, sir? Okay,
Sure.
sir.
No problem.
So, the very first question is, what made you decide, no, to become an ophthalmologist? Is there any background to that, no?
Meron naman. Well, of course, when you're med school, right? You're really not sure. And very, very few people lang naman knows what they want there from first year to second year. And then, wala. Actually, even up to clerkship, I don't know what I want to get into, no? Until I got into internship. Doon lang talaga, I don't know paano, but during the ophthalm rotation in one clinic day at the old OPD of the PGH, no, somehow there were so many interesting cases that day at the general clinic, and as an intern, I was able to actually diagnose 10 cases correctly, no? So parang iba-iba, no? May RP, may angle closure, mayroong strabismus, no? I mean, somehow that day, I had the whole gamut of diseases, no, that are seen in ophthalmology, no? So yun talaga. So I said, wow. I mean, and then I felt very happy about it, no, because parang ano yan, di ba? Seeing a patient being able to get the right diagnosis and you get good feedback from the residents, no, or from the monitors, no, you really feel good, no. So yun. I think if I can pinpoint one incident, no, in my entire history that made me go to ophthalmology, that was it. That was the day, no, that I said, I think my forte is in ophthalmology.
Talagang you were pointed to that direction.
Parang ganun. I don't know what happened. So that day lang talaga. Parang ang saya eh. Parang imagine, ang dami ko nakita, ang dami ko na-diagnose, tama naman lahat, parang, and I felt good. So, parang yun na nga. Unlike, when you go to IM or, parang, you're not even sure, you have to wait for all the tests, no, and you have to wait for it to come back and to see if your diagnosis is correct or wrong. But somehow, in ophthalmology, ang bilis eh, no? Parang, ang bilis ng feedback, no? Alam mo, nakita mo na kaagad yung problema, there's very, very minimal guesswork, no? And you can actually provide the information to the patient right there and there.
Sir, yung as a YO trainee, can you describe your experience when you were starting in training? Siguro kahit na ng a little bit when you were already actually starting your practice. Meron ka pang experience? I mean, what was your experience back then?
Well, in training, we know not just I sort of know naman the rules eh. I mean, of course na you're a first year, you have to go ganon, no. Alam mo naman na it's a stepwise approach, no. And sort of siyempre you've been in med school in UP and then you rotated in PGH. Siyempre may inkling ka din sa culture, no, of how the residency is run, how the people are, what are their personalities, no. Sort of na, no. So pinaghandaan ko na yan eh. Parang okay, pag first year, trabaho ka lang. No? You just do everything you're told, no? Just fulfill all your commitments and all your responsibilities, no? Complete everything, no? Parang huwag ka papagalitan, no? Huwag ka ma-Sunday duty, no? So yun na, no? It's like, do your job well, okay? Avoid getting, punished, no? So that's first year. And then my second year, so mas may leeway ka na, no? So you have to go a little bit more, and you're doing OOTs already. And I teach a lot. No? Even from first year ER pa lang, I'm sure all the class, yung clerks and interns after me, class 90, 91, 92, alam nila lahat yan. No? When I was a resident up to a chief resident, no, they know that I go to the ER, I make sure I teach all of them at 12 midnight, 2 o'clock in the morning, especially when I'm on duty. And I check all the charts. No, and when I was chief resident, I check all the charts of
Oh,
the
I
residents. So
heard.
basically, uh, doing it. No, you just have to do the job well, and not aspire also not to. And then you, in a way, you have to share it also what you know. No? Hindi mo lang
Yeah,
sa'yo lang, no? It's good to pass it on, no? To make sure that everybody is doing the things the right way, okay, that the knowledge and skills are passed on, no? So that's very important, no? Somehow it hindi naman mahirap eh. I mean, as always, no, if you enjoy what you're doing, okay, doesn't feel like work.
so sir,
So
speaking of
yun
that,
ang oo.
were there any parang meron ka bang special people or mentors, no, na nung time mo when you started, and how did these people help you kung meron man?
Well, there are during my time naman, we have all the uh, pillars of Philippine ophthalmology, Dr. Spirit, Dr. Romeo Espiritu, okay, they're still around. Uh, Dr. Of course, no, Dr. Valenton, Dr. Aquino, Dr. Agulto, okay. So Dr. Fajardo. So they were in a way you see their accomplishments eh, no? It's they didn't really at that point in time, no, bihira yung they outright talk to you, and it's not like nowadays. There's more rapport and connection between consultants and resident trainees. At that point, uh, ano pa rin eh, they're like gods, no? So parang they're nice, no? They talk to you, but very very difficult to go down. That you form close relationships, no? So you really just look up to them, and then you just um, basically role modeling, no? You don't have to say teach you directly. I mean, don't have to tell you indirectly. You just observe them, and how they act, how they talk, how they lecture, how they diagnose, how they treat other people, how they treat patients, and then you can see naman how they're treated by their colleagues, no? And then ganun yung ano. So you just have to find the right role models, especially when you're training, because I think that's the best way to learn.
Sir, do you think there's a difference between the young ophthalmologists now compared to when you were a young ophthalmologist during your time?
Well, I think I think one thing that did change is now we all always complain. Okay, I mean that
Starting
will not
from
go
me.
away. Okay. Pero maybe lang, it's just how we complain. Okay, so probably before, no, you just keep it and swallow it, and you just yun na. Okay, but nowadays, I think there's people are more expressive. No, so I think that's the main difference. No, again, uh, as I've said earlier, no, it's the people, younger uh, ophthalmologists now. No? It's they're more open, no,
Do,
to
do you think, sir,
form that.
do you think, sir, now na medyo iba na yung parang relationships with mentors, and now, do you think it's very important for the young ophthalmologists now to have a mentor of their own?
What do you mean a mentor of their own? A
I mean,
personal
to
mentor?
have a mentor, yeah, to have a mentor na, somebody na pwede nilang kausapin, no, or
Well, I mean, again, there should be that opportunity. There should be always that leeway for that, no? But it's not supposed to be required, no? Kung hindi naman kasi lahat pare-pareho eh. So some will need it. If they do need it, at least it's there. No? Some people don't need it, so they don't, hindi kailangan. So, pero ang importante, meron available sila. Meron silang somebody they can approach somebody they can confide in, no, I think there should be that pathway that should be available
Yeah.
because again, no, again the basic training the mentality naman before is, parang ngayon, bahala ka na. Okay. So, matira matibay. Well, in some way, ganun pa rin ngayon. Pero I mean, but now you're more conscious about good feedback, good communication. It's not only grades that we're after. Now we also want you to be good communicator. That you should have good, be compassionate, good ethics. That you should also do good record keeping. Ang daming-daming aspect na ngayon of in training ophthalmologists. No? Hindi lang purely clinical knowledge and surgical skills. No? So it must expand it. That's why the certain things naman there should be that again. As I've said, no, my opportunity to have a mentor, no, para ma-polish or ma-enhance that aspect, yep, that side of being
Ako
a
sir,
doctor.
kukuwento ko lang sa kanila. Kasi si Dr. Lim Bonchong, he's really one of my advisors, no, my mentors when I started. And then, in the middle of first year residency, I decided I wanted to quit kasi napapagod na ako. And si sir, he was in Taiwan that time, no? He called me. Actually, pinagalitan nga niya ako eh. Naalala mo ba yun, sir? Pinagalitan
Very
mo ako.
parang,
Pinagalitan mo ako na parang, don't do anything stupid until I get back. Ganyan, 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 ganyan. So, parang he talked me out of quitting my residency during that time. And, that's one of the, what, Dr. Lim Munchong and other consultants were very supportive of me during that time. Kaya nga, for me, ako personally, having a mentor is actually, it can be life changing sometimes, no? Kasi isipin mo, if you just said, okay, sige, mag-quit ka na, I probably wouldn't be an ophthalmologist now, no? Parang ganon.
yeah, James, you're not the first one. No, there are very many residents have approached me. Many residents have stopped. Okay, because that's actually from a personal experience from myself. No, imagine first year ka, first month, first quarter of the training, and you have to do an IO. Okay, you know how difficult it is to do an IO for the very first time. Okay, so we had this case na re- high Marfan syndrome with recurrent only eye with recurrent RD na we have to draw. Okay, the next day na yung surgery. Okay, so imagine after 2 or 3 hours of doing IO, wala akong makita or I don't even know what I'm looking at. So that was really, really, really so frustrating. Okay, talagang after that day, pinag-isipan ko, is this really for me? Okay. So that's normal naman, no? Hindi naman to have doubts, to feel bad, no? To feel frustrated. I think it's part of the journey. It's just that it's that again, if you're in it, mahirap eh. Akala mo that's it, ayaw mo na, sobrang hirap, end of the road, iba na. Pero look again, because through that experience and because I went on, tinuloy ko pa rin, no, despite that very frustrating night. Okay. Sabi ko, hindi kung I decided based on that, malaking ano yon. It was a very huge mistake, So I don't want that to happen to anybody else. So that's why pinagalitan kita. Yun.
Sir, sa ngayon, no, pero with everything that you've done, you've written a book, you've been the PAO president, now you're part of the board of ophthalmology, you've been chairman of St. Luke's, no, Department of Eye Institute. No, as successful as you are now, are there still things that you still want to achieve?
Well, kung tapos na sa Pilipinas, meron naman outside the Philippines. No? Basically, that's really my personal, no? That's my personal aim. To make representing the country, the Philippines, no, to make it shine, no, in the international arena naman, no? Kasi I always notice, no, in international meetings, no, parang Philippines always, I mean, I've seen a lot. I've seen, we're, I don't. I don't understand why they make us feel that we are inferior. Okay, but really we're not. No, actually we're much better in a lot of things. No, at the very least we're at par with many things. No, in the field of ophthalmology. No, maybe lang we're not noisy. We're not given the opportunity. No, to shine. No, so that's basically the things that I next chapter. No, is to really represent the country and to make Philippine ophthalmology known. Maybe it not really stellar as in the first world country, but at least do not. I want to change the perception na ay Philippines parang ano ba yan? Saan ba ang Philippines? Diba? Parang there's all something you talk to, they will think, oh, Philippines, parang okay, and they patronize you, parang, they don't think that you know a lot, no? So I want to prove them wrong.
So now, sir, what do you think is the present YOs? What do you think is the role of the YOs now at this present time?
The role of the YOs, I think that should be part of the I cannot do this alone. Okay, so be able to uplift Philippine ophthalmology. Always look at it two-prong, nationally and internationally. No, so some people can do it internationally, then go internationally. Some people concentrate nationally, then concentrate nationally. I mean, we don't have to do the same thing. Okay, hindi naman sinabi kung hindi ka international, you're not as good. That's not true. Okay, so you just have to do your best, find your niche, find where you're good at, and stick with it, and excel in it. Okay, so that's always my personal mantra. No? Okay, you can just be janitor, but if you're the best janitor in the world, you're still the best. No? Parang you just find you ganun yun eh. Okay, so look for your niche and do it well. No? So then yun lang, no? And follow that, no? And then you'll do well. Mm-hmm.
Last na,
Don't
sir.
or compare, no? Kasi nga, iba-iba naman. So, do not feel bad na you're not like that. It's not enough to have a role model, no? But you should also know yourself. You have a good insight of yourself, know your capabilities, no? Where all your opportunities lie, no? And then, just follow that. No?
Sir, last message. Any message to the YOs watching for us now before we end it?
Yes, no. So importante kasi ang opportunities. Okay, opportunities are not offered the same way to all of us. They don't come along the same. We're not provided the same opportunities. No, I mean that is probably the rule of the universe. No? So, but you have to be available. You have to be there. You have to watch out for opportunities. No? The timing is very important. But be able for these opportunities to come along. Okay, you have to make yourself excel. Okay, so be as good as you can be. Be as good as you can be in ophthalmology. Okay, and in all its aspects. So, kasi once you have that, that's the foundation. Then opportunities will come. And once opportunities come, then that's the only way that you'll go somewhere. So always. So in short, develop yourself well. Okay, do not lose the passion, and then always keep your eyes open to opportunities. So you don't waste them when they do come.
Yay. Thank you very much, sir. Thank you very much for being our first guest here.
I hope I was able to impart something, pero
of course, sir. Always naman. So that's our episode, our very first episode of How to Be Yopo, Meeting Our Mentors with Dr. Ruben LBS. Thank you very much, sir. Stay safe.
Thank you.
Stay
You
safe,
too.
sir.